welcome. You're watching Inspire India here on Mirror Now. I am Afrida Rahman. This is the show where we bring to you stories of the good Samaritans and those around us who have stepped up to help those in need. So we are going to bring you stories from across the country. We do that every day. Talk to people, those individuals who have put their own lives on hold in order to help others because they see misery around them, and in one moment they decide that they are going to start an initiative. Small steps have led to big networks, and that's what we will talk about today as well, because remember, for a country like ours, with the kind of population that we have, it is simply not possible for the administration to reach every nook and cranny. Therefore, these community partnerships, NGOs, foundations, civil society groups that have come together to help out are making an immense contribution, owing to which the country today is slowly but surely coming out of the intensity of the second wave. So we owe it to these individuals. Two such do-gooders, Good Samaritans, are with us today. Bhavna Madappa from Kolkata, who's part of an organization called Aamra that helps out the poor and the needy. Welcome, Bhavna. Thanks for joining us here on Mirror Now. Good to have you with us. And I also have Dr. Sunil Kumar from Bengaluru, who is actually running a mobile van, a mobile hospital of sorts, doing a lot of good to people, reaching their doorstep with medical care and medicine, something that is so crucial during the time of a pandemic, when it is not always possible to access hospital beds. So we are going to talk to Dr. Hebbi and Bhavna. Coming to you first, Bhavna. I know that you're a young girl, you are a working professional. Bunch of you have got together in Kolkata to do something different. Now tell us your backstory. How did Aamra begin?
Hello and good afternoon. Thank you so much for giving us this opportunity. Like you mentioned, yes, Aamra is a group of young professionals from West Bengal. We are just a group of people who have come together to try and support our state's frontline workers, COVID-affected families, and our daily wage earners. Before we even started this initiative, few of us didn't even know each other. We're a group of 10 people, and we decided one day that, we need to do something to help our community. A lot of us in our own group, and we see our friends and family directly affected by this pandemic. And, when you see it firsthand, you realize the severity of it. So we said that we also in that time understood our own privilege. We come from families who can afford food and medication, but there are so many countless people in our whole country who access to, medicines and food and other things to, battle this whole COVID crisis. So we came together as a small community initiative to help our state to, battle this COVID issue.
So you're saying that you are a group of young professionals, and most of you come from privileged families. You saw the misery around you. Did you have some sort of feeling that how can we stay insulated and privileged and not bother to step out and help those who are out there? Because I remember you telling me that many of you were also infected with the virus, and you knew what it was to go through it.
You're right. Many of us did get exposed to the virus. We saw our friends and family also suffering. And the physical and mental strain that it creates on a person, you end up realizing how bad it is and how much worse people must be having it when they don't have access to medication and proper health care. And as a group of, just young professionals from we realized we can't go out and promise people that we're going to be giving you ICU beds and oxygen and get admission into hospitals. While we try our best to do, we can't promise that. So we're trying to help out however we can. The dire shortage of, food with the lockdown in West Bengal, a lot of people are not being able to get the food as nourishment, to, just battle this crisis, go on day and night trying to help other people who are suffering. So what we are doing as a group is trying to provide them with the food, the ration, the nutrition that they require in this difficult time.
Yes, absolutely. Stay with us. Bhavna. I'll come back to you. Let me also go to Dr. Hebbi. Dr. Hebbi, at this point, I want you to share with us the kind of journey that you have undertaken, because you were a regular medical student, you were doing your internship, and you started this mobile van, this clinic way back in 2011. But there was an interesting turning point in your life that made you start this. Of course, at that time, there was no pandemic, but something that made you start this, which is now proving to be immensely useful. But tell us about how a regular medical student like you suddenly changes direction and takes up a humanitarian cause, Dr. Hebbi.
Because the healthcare is not available for the rural people and not accessible. Because we started, no one should die because doctor is too far or clinic is too far. To change that, we started mobile doctor clinic.
Yes, and
Hello?
that is something which is turning out to be extremely useful now. But yes, please continue. No, when you started in 2011, that time there was no pandemic, but something made you take that decision. If you could share that experience with us, why you started this mobile van, this mobile hospital.
Yeah, on busy Vasu Road, I seen one accident. That time I given basic primary care to the accident victim, and I admitted that patient into a nearby hospital, and then I written my name and attendant's name. That time came to know that they called me and they said me, you saved my son's life. I'm so happy, and I want to meet you, sir. And they are literally crying, and they said they came to my hospital and they met me and they have given me food and everything, and they are literally crying and they are so happy because I saved her son's life, huh? I feel because it's not a big thing being a responsible citizen, being a doctor, I did my job. But the thing is, later I got to know that because I have to convert into mobile clinic because first aid kit is not enough to start finding some portable things, portable table, chair, ECG machine, glucometer, thermometer. Now recently we even added oxygen concentration machine and cylinder.
Okay. So that's interesting. We are seeing that in the pictures, Dr. Hebbi. Now, what is interesting in your case, of course, highly commendable. And like you said, I'm doing my job, but actually you're doing much more than your job. I mean, there are so many doctors who are serving hospitals, but you have taken it upon yourself to reach out at the doorstep, literally, of people who need medical care. And to begin with, you started with your own private car, refurbishing it into some sort of a mobile clinic. And now, as you go along over the years, perhaps you have acquired more vehicles and you're doing this. But, this is again something interesting. The fact that something like this can be extremely useful during a pandemic. When you were doing this, there was no coronavirus. But now, when all the more it's important for people to stay indoors, hospital beds are scarce, something of this nature, Dr. Hebbi, is very, very important and critical. I'm going back to Bhavna once again. Bhavna, the stories that we feature here on Inspire India are stories of individuals like you, young people like you, who have put their own lives on hold because they were moved by something or the other to do this. That is one. But, you have also personally visited these hospitals and these locations where people are waiting for food. Now tell us, what have you seen so far? Share some interesting experiences from your journey.
When we go to do our food distribution, we see there are a lot of people. We go to government hospitals. We see there are a lot of people waiting day and night to get the care that they require. They have a lot of family members also who go through this journey with them. So there are countless people waiting in and around government hospitals. So when we go there, we've spoken to a lot of them. And what they say is that they're trying day and night to get beds and medication. They're completely exhausted. They're trying to get oxygen. They're trying help from doctors and nurses. They have little to no time to think about themselves. While many of them don't get the care, but the ones that hospital beds, they do get the food, the medicines, and the oxygen. But their family members who stay day and night in the hospitals have little to no time to think about themselves. We heard stories of wives and children spending days sleeping in the hospitals, sleeping in the premises, just gathering around, trying to be there for their families. So what we are trying to do is try to help them, not just the patients. I do understand the patients require the first comes out, but then even their family members who are going through so much and are probably also exposed need the help. So what we try to do is we try to feed them meals. We are doing currently about 600 meals a day at different locations of government hospitals in Kolkata. We do cooked meals containing rice, dal. There are a lot of very responsible citizens who have stepped and told us that, we'll donate biscuits, packaged food, bananas, apples. So what we do is we combine our cooked meals with, some of these snacks to give it to the people who are waiting in the hospitals so that they get some nourishment for themselves. So we carry on every single day.
Yes, this is very important, Bhavna. The fact that you've identified that these are district hospitals, government-run hospitals, where mostly the underprivileged section, they turn up for medical care. And it often happens, and you were sharing this with me earlier as well, that they just about have enough to buy medicines. They do not have that much money to sustain themselves and to buy food. So then they have to choose between either they can buy the medicines for the patients that they're attending, or they buy themselves food. And that is something that you're catering to now by providing meals to these attendants who are waiting around in these hospitals. And there are quite a lot of them in these district hospitals all the time, which Bhavna and her team helps out. They have reached out to them. They cater to their meals. 600 meals a day is what they are providing. But Bhavna, do you think that there is need for more? There's need for more voluntary organizations to pitch in because, I'm sure that the numbers in the peak of the pandemic at least must have been very high, and to cater to all the attendants must have been a difficult job for you.
You're right. Like you mentioned, a lot of people are in this dilemma. They don't have enough money. So they're choosing now, can we buy medicines or should we buy food? And obviously, it's a pandemic, they all are going to the medicines. So we are trying to give them the food, but we see every single day while we're providing these meals that there are people lined up outside our, just in line when we're distributing. And every day, once our meals get over, we see there's still 50 people waiting in line, wanting the food. But, they come back in the hope the next day that they'll get a meal. So our target now is to reach more people. So with, generous contributions and volunteers, we're trying to reach more locations and more people. We are in the coming week going to do 1,000 meals a day. So hopefully do 30,000 meals a month for the next crucial months. But we do see that, no matter how much you do, there are so many people in need. There are more people who will want this. So we want to use this opportunity to actually tell just about anyone in the community, please step up, please volunteer, start something of your own, get together with your friends and, like-minded people to just, if you can help even one other person in this time, it is a huge deal. There are so many in need right now.
Yes, so there is a need for more people to step up and contribute if they can, because like Bhavna tells us that this is the time where we all need to actually have our eyes and ears open about those around us, those who are suffering. And these kind of efforts, of course, have gone a long way. In Kolkata, Mission Aamra is doing tremendous work, and I'm going to just, for the sake of our viewers, once again, talk about the fact that this is a collaboration of young professionals. They all have jobs. Some of them are working in the IT sector. Some of them are working in the corporate field. They all have full-time jobs. But it's just that from their position of privilege, they realize that they just simply cannot sit back and watch while others around them are suffering in this manner, and just cannot keep thinking that there will be some afsar or some government help coming in. They just have decided to do it, take it upon themselves to help. Now, this is the kind of spirit that we are celebrating here on this show. Dr. Hebbi, from you as well, I mean, this is a similar thing, isn't it? That you just don't want to sit back and do your regular 9-to-5 job or your regular job when you know that you can do a little bit more. What inspires you to do that little bit extra? Because not everyone is doing it.
No, the thing is, from last 13 years I'm doing, but I quitted my job, corporate job, to do this because healthcare should be a service, not a business. Because the thing is, everyone in a villages, they need basic primary healthcare. Prevention is the better than cure. For that reason, we are traveling across the villages, slums. Every day, we are treating around 20 to 25 patients at their doorstep with the help of volunteers, some other people. But the thing is, we are treating only 20 to 25 patients in a day. If we get a support from a people to support to purchase a van, tempo traveler van, we can treat 100 to 150 patients to visit slums or some other areas. Because we are concentrating on now to purchase a van. If supports someone, it helps me a lot to do more.
Okay. Absolutely. And I was just looking at your
This is the
schedule
thing
after
going on.
completing his shift from 8 p.m. to 8 p.m. to 8 a.m. It's a night shift that Dr. Hebbi does at a BBMP COVID clinic where he works on a contractual basis. He's a former resident doctor at the BGCS Global Hospital. He takes a 2-hour break, and by 10 a.m. he's ready to zip across Bengaluru. It's not easy, viewers, to do this. Think about it. After having done your full shift, this is something that you're doing beyond your call of duty. So, Dr. Hebbi, you were saying earlier that I'm doing my duty, and again, I want to emphasize you are going beyond your call of duty to do this, and that's what we salute you for. Within a month of extending the clinic work hours, Dr. Hebbi has been able to treat close to 250 patients. This is the idea which I want you to talk to us about, Dr. Hebbi, about a mobile van, how useful it is at a time like this. Why don't we have more of this when everyone is clamoring for beds? Isn't the administration aware, or seeing an example like yours, hasn't it struck anybody that why don't we get a whole network of these mobile hospitals or mobile vans to cater to people? Can it work, Dr. Hebbi?
Yeah, 100% it works. If they do on a mobile vans like as I am doing, it helps a lot. We are meeting a direct COVID positive mild patients. It helps them because primary care is the most important thing. We are neglected. Many people are not taking medicines. Even they cannot afford 100 rupees medications, and we are distributing medicines, pulse oximeter, even infrared thermometer for those who are genuine need.
Absolutely.
Yeah, whatever we have treated as of now, around
this must be
around
replicated
250
in other
plus.
cities as well.
Yeah, exactly. Yeah, but the thing is, yeah.
Okay, no, I thought you were saying something and I interrupted you. Anyway, so I wanted to basically ask you, Dr. Hebbi, that, with a schedule like yours, with this kind of full-time dedication, what about your own personal life? And, would you have to put a lot of things on hold? How do you manage to dedicate such long hours to your job and to this humanitarian work?
Yeah, it's a very challenging, and also I'm struggling a lot for the financial things to take care of my family or something, because since last 13 years I'm doing, but my family is supporting. My mother, father they are very supportive, because since last 12 years they are seeing my journey, and I'm doing it's not a service, it's a responsibility. Being a citizen of this country, being a doctor, healthcare should be too reachable. No one should die because doctor is too far or a clinic is too far. To change that, I started this mobile clinic.
Many times from all the real life heroes that we have on the show, that they think it's their responsibility, they do it in the patriotic spirit for the country, they never feel that they're doing anybody a favor. Now that's again something that we must all perhaps learn from. Bhavna, anything that you have to say on this? There's so many individuals out there, many, of course, voluntary organizations also, who are doing this. And like you said, every single effort matters at a time like this. But in terms of the support also that you need from your families, like Dr. Hebbi says, his family is supporting him in this. What about uh, professionals like you, young girls like you, do your families, your parents approve of this idea? They allow you to venture out? There are health risks as well to venture out and go around hospitals distributing food. These are again potentially dangerous and risky zones to be hanging around.
You're right. In our group, we have a lot of professionals. We have legal professionals, we have content strategists, athletes, designers, architects. We are all professionals. Our families have luckily been extremely supportive. We have tried our best to reach as many people as possible. As you mentioned, and as Dr. Hebby mentioned, we have our day jobs, and we take out time from our day to make sure that, even if we can't go on the ground every single day, we sit at homes and try to plan and strategize and connect with people. Our plan right now is not to start everything from scratch. As it's a initiative, the need is right now. There are so many people who need the help immediately. So it's not for us to start from scratch and, make a name of ourselves. Tying up with local NGOs, local distribution partners who have been doing this work for a long, long time. And we connect with them. We try to form partnerships and collaborations so that we can actually reach those, remote areas, the people who actually don't have access to a lot of things. We are trying to reach those people. So that is our aim, and luck. The support, we have got support from donors and volunteers, but we also do hope we continue to get this support in the coming months to help so many people.
Yes, Bhavna, I was discussing this with you earlier as well, and in the footage also it's visible that a lot of these poor people, they're not wearing masks. They're fully exposed. I mean, don't they have the awareness about the dangers of coronavirus? Because you were mentioning that because of their level of deprivation, the corona fear almost becomes a small thing for them. Is that what you observed?
You're right. In a lot of places, specifically in rural areas, we have seen that coronavirus is the lesser of two evils right now. For daily wage earners, they're coming and telling us things like, we would rather expose ourselves to the virus, but we need our income for that day. Otherwise, we can't feed our families, we can't feed our children. They are going about without getting even 1 square meal a day. There are lots dying out of starvation today. So what they're telling us, we'd rather go and we don't really care about the virus. We just want the food. So that's where we have tried to step in. We see that there is a huge medical issue due to the pandemic, but there are a lot of people who have lost their jobs due to the lockdown. A lot of daily wage earners have had to go back to their villages, have had income in the last few months. So we have also, in addition to our cooked that we have at hospitals, we have also started an initiative where we provide ration packages to these daily wage earners in and these rural areas. So our ration packages contain ration like rice, lentils, soya nuggets, salt, and oil. We have already distributed ration to 1,000 families for this 1 month, but we aim to go ahead and expand and do 10,000 families over the course of 3 months, because these are the crucial months. We see that the lockdown is not easing. We see the COVID crisis is very much present, are actually...
More power to you, Bhavna, and I really wish you all the best with the next milestone that you have set for yourself. 2 things I'll say before I wind up. One, on the part of Bhavna, that they need more contribution to reach out to more people, because they are now planning to reach out to those who are ravaged by Cyclone Yas in the Sundarbans. A lot of homes have got ravaged. They immediately need food to eat. So that is where they need contribution. And Dr. Hebby was telling me that there is a need for more tempo traveler vans, more mobile vans, so that he can expand his network and serve more people. So if you want to reach out to them, I'm going to take this opportunity to appeal to our viewers to watch out for initiatives like this if you can help. Thanks for watching Inspire India. Thank you, Dr. Hebby and Bhavna, for joining us. With that, let's quickly take our viewers through some more stories coming in on Inspire India today. With curbs in the valley having impacted lives in ways more than one, a group of volunteers are serving healthcare workers. The volunteers served cooked meals to those working in hospitals and dry ration to daily wage workers. In a bid to serve those in need, a school administration from Hyderabad has converted the school into a COVID isolation center. The school administration says the isolation center was set up for those who are unable to afford isolation centers in the city. In a bid to ensure a dignified farewell for the deceased, volunteers from Red Cross have been performing last rites for those who were abandoned by their kin or those whose relatives were unable to conduct the ceremony. Well, that's it for now. News and updates continue on the other side. Stay with Mirana.